The liver is one of the most vital organs, filtering everything we take into our bodies. Hepatitis is a condition that has several forms, all of which endanger the function of the liver. TGMC would like to raise awareness in our community of the severity of this condition and the ways it can be prevented.
All right, with that said, To Your Health with Terrebonne General Medical Center, I'm Martin False, and joining us now, we're glad to have him on board, is Dr. Khalid Moussa. Doc, thank you so much for being here tonight.
Thank you for having me.
Oh,
Thanks, Mr. Martin.
You're quite welcome. And of course, hepatitis. To explain to the audience, first of all, what is hepatitis?
The word hepatitis simply means inflammation of the liver. The suffix itis means inflammation, and hep means liver. And it's a common injury to the liver which causes inflammation and swelling.
Okay, that made it quite simple. Thank you for that. What are the different kinds of hepatitis?
We tend to recognize them by their causes. So there are viral hepatitis, which comes under hepatitis A, B, and C. And there are drug hepatitis, including alcohol-related hepatitis, as well as medication-induced hepatitis. There are also two conditions which are extremely important. One of them is fatty liver, which is injury to the liver from accumulation of fat and scars. And there is immune hepatitis, where the cells of the immune system of the body attack the liver cells and produces damages.
All right. Now, the symptoms of hepatitis, are they narrow or do they range in different areas? What are they?
In the most common symptoms is nothing. There are certain types of hepatitis which can present with acute symptoms, like hepatitis A. And this tends to produce yellowish discoloration of the skin, pain under the ribs on the right side where the liver is located, loss of appetite, and fatigue. But the majority of chronic hepatitis actually produces no symptoms unless people develop complications or very non-specific symptoms like fatigue, loss of appetite, joint aches. We are not certain or clear why these symptoms occur.
Okay. Now, Doc, how would you test someone for hepatitis? What would they expect?
The gold standard is lab test, simple blood tests. Initially, you get a screening tests for the viruses, and later you get a tumor marker or a virus marker to confirm that screen. The degree of the hepatitis you can evaluate also with the blood tests, including liver functions and bilirubin pigment. Finally, in complicated cases, you might consider obtaining imaging studies like an ultrasound or more invasive testing, which is not necessary in every case, with a liver biopsy where you take a small sample of the liver to assess how much damage did occur.
All right, what we're going to do, we're going to take a short break, talking about hepatitis tonight with Dr. Khalid Moussa. And after the break, we'll be right back with more questions. Don't go away.
I saw a fire truck at a parade and I said, this is pretty cool. So I bought one. I'm Bill O'Quinn, and I was treated for prostate cancer at Mary Bird Perkins in 2005. I'm a retired Prudential insurance executive, and with the coverage that they provided, I could have gone anywhere for treatment. I got a tour, and I was incredibly impressed. Mary Bird Perkins not only has the best technology, but it's right down the street. So why would you go anyplace else?
Mary Bird Perkins Cancer Center at TGMC.
Put together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
Sudden confusion can be a sign of a stroke. The first 3 hours are critical. To learn more about strokes, go to the experts. The Stroke Specialty Program at TGMC. It all begins here.
All right, welcome back. We're talking about hepatitis with Dr. Khalid Moussa with Terrebonne General Medical Center. He's a gastroenterologist, and we got a few more questions for him. First of all, how do you treat hepatitis?
The best treatment, Mr. Martin, will be prevention. Avoiding, for example, alcohol overuse. Avoiding obesity and overweight. Practicing safe lifestyles. Not avoiding sharing needles, using recreation drugs. The second thing is vaccination. Hepatitis A and B vaccination is available now routinely for children in the schools. Taking your prescribed medication within the prescribed dose. And finally, recognizing the etiology, like medications, and withdrawing the offending agent. Now, in well-established cases, like for hepatitis C, the commonest form of treatment will be a combination of pills called ribavirin and injection called pegylated interferon. This week, we had very exciting news of additional treatment which will double the cure rate for hepatitis C.
Oh, that's great. That's fantastic. Now, how can someone watching, how can they prevent themselves from getting hepatitis?
Common sense. The blood transfusion used to be a major risk factor. It's extremely rare now because of the screening we have with the available tests. If your partner have hepatitis C, you have to make sure you don't share razors, you don't share dental brushes, but simple hugging or kissing will not transmit hepatitis C. Sexual transmission is extremely low, so we don't recommend any extra precaution as long as you are in a monogamous, stable relationship. Avoiding HIV infection, avoiding using straws, avoiding smoking recreation drugs. All of this will prevent injury of medication drugs.
Okay. Now, someone watching, how can they learn more about what you're talking about tonight?
They can always discuss this with the primary care doctor. They should feel being a partner in their management. They can always approach one of the local gastroenterologists. They can also, there is plenty of information in websites which is freely available for patients.
There you see it on the screen right there, 873-4141, or you can visit online at www.tgmc.com. Dr. Khalid, thank you so much for coming on tonight.
It was a pleasure, Mr. Martin.
All right, we're going to take a break, and when we come back, we're going in the kitchen with Canadas, so don't go away. It's up next.